Hello everyone, this is part 3 of our interview with Dr. Moheimani, and this slide is on the grading system. Go ahead and take over, Doctor.
So the meniscal injury can be graded based on its severity. It's pretty straightforward. There's 0, 1, 2, 3, and then within 3, there's breakdowns on the severity of the tear. This kind of helps the physician kind of grade and evaluate how severe your injury is.
So if you're able to walk, would that be like a 1 or a 2? And then like 3, you can't walk at all?
It's actually based on not so much functionality, but more just how much of the meniscus looks to be involved in an MRI scan usually.
Okay, so it's based off the MRI scan?
Mm-hmm.
Correct. Okay, next slide.
Sure.
All right, next slide. Okay.
So I kind of have alluded to this in the previous videos or discussed this in the previous videos that studies have shown that doing surgery, so arthroscopic means they put these like little cameras into your knee and then they kind of use ports to cut down and shave down the meniscus. There's this incredible study done in a very strong medical journal called the New England Journal of Medicine. For those that are not familiar with medical literature, New England Journal is one of the top publication sources for medicine, the whole field of medicine. And this article basically shows that they did surgery, arthroscopic surgery on patients that have they have degenerative tears of their meniscus, kind of the category we were talking about earlier. And they showed that with the degenerative older population, and these are patients in their like 40s and 50s, that surgery doesn't really seem to benefit them that much, meaning that these patients didn't necessarily do better in the long term, even with the surgery, compared to physical therapy. So that's kind of an interesting thing. So it goes back to our discussion about making sure that you're an appropriate candidate for surgery, because surgery does not always work.
Yeah, and let me give some anecdotal evidence. So I know someone that went straight to an ortho. The ortho never brought up PRP or any kind of regenerative medicine. So if I'm a 40-year-old or a 50-year-old and I'm trying to avoid surgery, do I look to go to, like, is there a specific doctor I can go to that will at least recommend this stuff? Because, I have a friend that she went straight to an orthopedic surgeon, and the orthopedic surgeon was just like surgery and didn't really give any other options. So is there a specific doctor that we could go to that might be able to offer other avenues other than surgery?
So yeah, that's a great point. So the thing is, you really have to know the doctor. And there's a saying in medicine that a hammer only knows nails. So meaning like if you're a hammer, you're just going to nail, you're going to see nails and you're going to want to hammer it, right? So you have to pick a doctor that gives you all, that discusses the risks and benefits and alternatives. That's why you should seek out a physician that, when you ask them like, okay, so what are my options? You would hope that they would say, surgical, and that's actually the growing culture now more than ever, is that trying not like non-operative measures before you progress to the idea of surgery. With the exception, again, being if you really have an unstable knee that like there's mechanically something there that's causing you to lock or swell, then maybe at that point. But otherwise, you really should consider physical therapy and injections before you think about operating on your knee.
Just a red flag for our audience. If you go to a doctor and immediately they're saying surgery and it's not like a serious thing and they're not recommending any kind of therapy or pain management, that should be a little bit of a red flag, right?
Well, again, it depends. Like if you have an ACL tear, if you're a young athlete, then yeah, it might be indicated for you to do surgery. It's really hard to tell, but the thing is, you have to, again, like that's why I was mentioning the second opinion thing. It's really good to listen to your doctor and see what they have to offer, and then if they are offering surgery, maybe consider getting a second opinion to see if they think the surgery is indicated. This is more of an issue in non-academic centers again.
Okay.
Big health systems like Kaiser or UCLA, UCI, I feel like this should be less of an issue. But the thing is, they don't offer PRP at these institutions.
They don't or do?
Disappointment.
Oh, so they don't offer PRP yet? They don't have cutting edge stuff?
To my knowledge, they don't. UCLA is actually looking to transition to PRP, but a lot of academic centers are now slowly starting to build up on the PRP.
Why are they so slow to adopt it? And then like you have our dad adopting it a year or 2 years before these academic centers do.
I think academic centers are looking for a lot of cutting edge research. But the thing is with PRP, although you'll see that the research is in its infantile state, the exciting thing is that like there's patients that have pain and their knee doesn't feel good and they're not a good candidate for surgery, and the alternatives for them are very limited. So I'd argue that why not try PRP, because if surgery is not working for you, it's not an option. The next set of injections are not, there's not that many good options left. So that's why I really, consider PRP, because of its low profile, side effect profile. It's not, it doesn't have that much risk. So that's why it's kind of this new thing. And we're trying to figure out exactly what it works for, but again, the risk is low and the reward could potentially be very high, especially if you don't have to do surgery.
Okay. Are we done with this slide? Should we move on to the next slide?
Yeah, let's move on.
Okay. Lonzo Ball.
So Lonzo Ball, when the time of this article came out, he actually had not done surgery. He had a meniscal injury. The injury had been leaked to the press. There's been rumors that the reason they leaked this to the media was to actually prevent the Lakers from trading him. So kind of genius move on his part. But if you go to the next slide.
Okay, well, before we go to the next slide, we're actually kind of running short on time, so I'm just going to go ahead and make a new video so we can go into detail. And I do actually, before we go to the next slide, I do want to talk a little bit more about Lonzo Ball and his trade situation in the next slide. So we're going to go ahead and just start a brand new video. We're going to talk about this and move on to the next slide. So thank you very much for watching, guys, and we will start part 4 on the next slide.